If you constantly feel exhausted, even after you're sleeping well, you're not alone. Fatigue is one of the most common symptoms I see in rheumatology clinics, and many patients tell me the same thing. I just don't feel like myself anymore. This type of fatigue is very different from simply being tired after a busy day. It can feel overwhelming, persistent, and difficult to explain. In this video, I'm going to talk about autoimmune causes of fatigue, why they happen, what conditions can cause them, and when you should seek medical advice. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with an important question. What is the difference between normal tiredness and fatigue? Normal tiredness usually improves with rest or sleep. Fatigue is different. Fatigue is often described as a deep physical and mental exhaustion that does not improve properly with rest. Patients often describe feeling drained, struggling to concentrate, low motivation, muscle heaviness, needing to rest during the day. Some patients say it feels like their body is running on empty. Now, fatigue can have many causes. Stress, poor sleep, and lifestyle factors can certainly contribute. But one important category that is often overlooked is autoimmune disease. So why do autoimmune diseases cause fatigue? Autoimmune conditions occur when the immune system becomes overactive and attacks the body's own tissues. This ongoing immune activation creates inflammation throughout the body. Inflammation affects energy levels in multiple ways. It can affect the brain, muscles, sleep quality, hormones, and overall metabolism. The result is persistent fatigue. Now let's go through some of the common autoimmune conditions associated with fatigue. One of the most common is rheumatoid arthritis. Many people think rheumatoid arthritis is simply joint pain and swelling, but fatigue is actually one of the most significant symptoms. Some patients experience fatigue even before the joint symptoms become obvious. Inflammation from rheumatoid arthritis can affect the entire body. Pain and poor sleep can also worsen fatigue further. Another important condition is lupus. Lupus is a systemic autoimmune disease, meaning it can affect multiple organs. Fatigue is extremely common in lupus and can sometimes be severe. Patients may experience exhaustion even during relatively mild disease activity. Lupus fatigue can fluctuate with good days and bad days. Sjögren syndrome is another condition strongly associated with fatigue. Many people know Sjögren's for causing dry eyes and dry mouth, but fatigue is often one of the most disabling symptoms. Patients frequently describe profound tiredness and brain fog. Inflammatory conditions affecting the spine, such as ankylosing spondylitis and axial spondyloarthritis, can also cause significant fatigue. This is partly due to inflammation and partly due to disrupted sleep from pain and stiffness. Now, another important condition to mention is fibromyalgia. Fibromyalgia is not classically autoimmune, but it commonly overlaps with autoimmune disease. Patients with fibromyalgia often experience widespread pain, poor sleep, fatigue, concentration difficulties. Fatigue in fibromyalgia can be severe and frustrating. Now, autoimmune disease is not the only medical cause of fatigue. Anemia is another important factor. Inflammation can sometimes lead to anemia, which reduces oxygen delivery around the body and contributes to exhaustion. Low iron levels, vitamin deficiency, thyroid problems, and sleep disorders can also contribute. So when assessing fatigue, it's important to look at the whole picture. Now, one of the most difficult things about fatigue is that it's invisible. Patients often tell me, "You look fine," but internally, they feel exhausted. This can be emotionally difficult because fatigue is often misunderstood by family, friends, or employers. And this is why recognizing fatigue as a genuine medical symptom is so important. Now, what should you look out for? Fatigue becomes more concerning if it is persistent, worsening, affecting daily life, associated with pain or stiffness, associated with swollen joints, associated with rashes, associated with weight loss, associated with fevers. These symptoms may suggest an underlying inflammatory or autoimmune condition. Now let's talk about what can help. The first step is identifying the underlying cause. If fatigue is related to uncontrolled inflammation, treating the autoimmune condition often improves energy levels significantly. For example, patients with rheumatoid arthritis often feel better once inflammation is controlled with medications such as methotrexate or biologic therapies. Sleep is also critically important. Pain and inflammation can significantly disrupt sleep quality. Improving pain control and sleep habits can make a major difference. Physical activity is another key factor. This may sound surprising because many people feel exercise will worsen fatigue, but gentle, consistent activity often improves energy over time. The key is pacing and consistency rather than overdoing things. Nutrition also matters. Balanced meals, hydration, and avoiding excessive alcohol can support energy levels. Mental health is another important area. Living with chronic symptoms can affect mood and emotional well-being. Stress and anxiety can worsen fatigue further. This does not mean fatigue is all in the mind. It simply means physical and emotional health are closely connected. Now, many patients ask, should I get tested? If fatigue is persistent or unexplained, it's worth discussing with your doctor. Blood tests may be needed to look for inflammation, anemia, thyroid problems, vitamin deficiencies, autoimmune markers. The important thing is not to ignore persistent fatigue, especially when associated with other symptoms. Now, another important point is that fatigue management is often multifactorial. There is rarely one single quick fix. Managing fatigue usually involves treating inflammation, improving sleep, pacing activity, managing stress, optimizing overall health. Small improvements across multiple areas often produce the best results. Now let's summarize the key messages. Fatigue is very different from normal tiredness. Persistent fatigue can be a symptom of autoimmune disease and inflammatory conditions. Common autoimmune causes include rheumatoid arthritis, lupus, Sjögren syndrome, inflammatory spinal arthritis. Fibromyalgia and sleep disruption can also play major roles. If fatigue is persistent, worsening, or associated with other symptoms, such as joint pain or swelling, it's important to seek medical assessment. The good news is that once the underlying cause is identified, there are often effective ways to improve symptoms and quality of life. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.